Assalamualaikum and good morning to Sir Muhammad Fadli Syam bin Samsudin and to all my fellow friends. We are group that posting at Pediatric Ward Bau. We present our project proposal. Before that, I'm going to introduce my team members. Yuvanis Subramaniam, Shakira binti Hazim, Norish Emilia binti Noris Mansyah, Nur Nazira binti Syafa'in and Nur Hanani binti Ramlan. This is our content, Chapter 1 Introduction, Chapter 2 Literature Review and Chapter 3 Methodologies. For the introduction in our proposal, the first is students were assigned to conduct and implement an innovative projects in the respective work attached as a part of the assessment of the course. The second is it aims to stimulate the critical thinking skills among the students as students are needed to identify the current problem or condition encountered at the respective ward, thus encouraging the brainstorming idea and solutions to improve the patient health care need. The third is to innovate change that bring improvement to the wards and quality of the nursing care. For the background in our project, the first is according to the Royal in 2022, the phototherapy is a treatment for jaundice where skin exposure to a light source converts unconjugated bilirubin molecules into water-soluble isomers that the usual pathway can excrete. The second is according to the ISA in 2022, the iPad is to prevent the complication of phototherapy that will cause retinal damage. The third is usage of tapes and medical adhesive to attach the iPad to the baby's skin, thus creating additional complication associated with a localized skin irritation and allergic reaction. The last is nurses face challenge in removing the tape from baby's skin during baby bath. So it will irritate the baby's skin and will consume a longer time to remove it. Here are the examples of innovative ideas that were brainstormed by our group. The first is multi-purpose tray, and it rejected because it is difficulty in finding and preparing the suitable materials, also high cost requirement and difficulty to build it. The second is wire mesh toy, also rejected because dangerous to the baby due to the tiny bits used for the mesh. The third is iPad for phototherapy, and it is chosen. You want to protect the baby's skin from getting irritated during phototherapy treatment and also to reduce the time consumed to wear and remove it.
We also encountered some problem statement as below. The issue that we might always encounter during or after the placement of iPad was the development of rashes, redness, skin allergies or irritation caused by the micropore and leakage of light. Placement of iPad with a micropore for a very long time will impact and reduce the closeness between the mother and the infant. Our primary objectives as shown. First one is to protect from harmful light during phototherapy treatment. Second, to have less pressure and irritation around the orbital surface. The third one is to prevent unwanted dislodgement of iPad and allows for a perfect fit. And finally, to eliminate discomfort when the baby turns its head. Next is the significance of the iPad. As future nurses, we have to try our best to provide good care to the infants and ensure the infant receives safe, painless and reasonably comfortable care without causing any injuries or irritation around the orbital surface. It is crucial to provide them with an eye mask that is adjustable, latex-free and has a soft headband for optimum comfort. This innovative project is important to improve the quality of pediatric health services in the pediatric ward at Bau Hospital and is the staff nurses' work due to fever problems arising from the phototherapy.
Okay, so for the first literature review, were iPad in infant phototherapy by Silva et al. 2008. iPad have been used to act as an eye protection for neonatal patients who are receiving a phototherapy. Okay, based on a study of Woodgate 2015, eye masks for a newborn are frequently composed of opaque and sterile materials and elastic nonwovens or a cotton fabric, flexible plastic film and pressed pulp fiber, or a mix of this material will built in a multi-layer shield, while the others are maybe anatomically shaped to fit over and cover the infant eyes, where the iPad is like glasses. So in order Due to the soft fabrics materials that have been used in the phototherapy iPad, the edges are smooth enough for newborn's delicate skin, and it's creating no skin irritation or hypersensitivity. Alright, so for the next part, which is function and advantages, the study by the Woodgate 2015 state that the usage of the neonatal iPad in phototherapy, it helps it to prevent the retinal damage due to the prolonged exposure of the blue light. But, however, there are no retinal injury from phototherapy has been recorded in any hospital setting until now. So there are many advantages that have been found by using the iPad in phototherapy, where the study by Selikar 2020, it helps to secure the iPad more firmly and prevent the infant skin from getting any injury or redness. Besides, it helps to reduce the skin's allergy reaction to the baby. And lastly, it aids in developing the mother-infant bonding that helps the mother of the infant to easily fasten or remove the iPad when she needs to breastfeed the baby.
Based on literature review, phototherapy treatment have their challenge and issue. Conduct research by the Sai Akil and Demke 2021, phototherapy light can cause ocular side effect. It is due to the higher penetrance of blue light than UV light when a baby's eyes were not properly covered with an iPad. Next, another challenge and issue that been identified by Silva et al. 2008, most maternity wards and hospitals have been identified episodes of allergy and superficial skin irritation to the baby caused by the tape adhesive substance or small lesions resulting from the cut edge of the X-ray film in contact with the infant's skin.
Okay, for the prototype budget, the total of our budget is 70 ringgit. Okay, the design of ice sheet mask, we are contain of 4 designs of the ice sheet mask, which is A, B, C, and D.
We propose 4 designs for the eye sheet mask. The first design is Design A. Design A uses the method of full sew. The pros and cons for this design is more secure in terms of design and safety, user-friendly, adjustable, and also affordable. And for the cons, insufficient manpower to sew the product and time-consuming to produce it. Next, for the design B, we use the method of sew on the iPad edge. The pros and cons for this design is save time and energy, affordable, and for the cons, it's easy to dislodge and not user-friendly. The third design is Design C. We use the whole method. The pros and cons for this design is save time and energy, affordable, user-friendly, it can be adjustable, and the con is easy to dislodge. The last design that we propose is Design D. This design uses the fabric glue method. The pros and cons for this design is save time and energy, affordable, and for the cons, easy to dislodge and not user-friendly to the baby's skin.
Okay, next is population and sampling. For the setting is pediatric ward, which is Bau Hospital, and target population is staff to put the iPad on the baby under phototherapy. The type of sampling that we use is homogeneous purposive sampling technique. Okay, inclusion and exclusion criteria. For the inclusion criteria is the staff at the pediatric ward in the hospital Bau. Second, the staff are willing to participate in the study without being forced. The exclusion criteria is nurses at the other units in Bau Hospital. Okay, next is ethical approval. Ethical approval is obtained from director of Bau Hospital and will be enclosed with an informed consent form, and all information will be kept confidential. Okay, this is our Gantt chart.
That's the end of the presentation of our proposal. Comments that we received from the director of the hospital Bau are, she asked us to run a trial on newborns and also asked us to present the outcome of our innovative project in our next meeting with the director of hospital Bau. She also likes the idea of us creating the iPad for the baby. Also, we as a group made some improvements to our iPad designs due to the iPad dislodges when the baby turns its head, causing skin irritation, redness, and the baby's skin allergic, especially at the helix part of the ear. And last but not the least, I would like to thank everybody and wish you that you have a nice day.